My name is Olivia Dumas, and this is my complex sterile dressing change competency for Tuesday lab at 1:30. So the very first thing I'm going to do is check my MAR, and I see that I have an order for a complex sterile dressing change. I am going to identify my patient using name and date of birth. I'm also going to ask them if they have any allergies. Prior to starting this procedure, about 30 minutes beforehand, I would assess my patient's pain level on a scale of 1 to 10 or using the FACES chart and administer pain medication if necessary, and I would allow 30 minutes for that pain medication to take effect. So I will enter the room. I'm going to introduce myself to the patient. Hi, my name is Olivia. I'm your nurse today, and we will be completing a complex sterile dressing change on the wound on your abdomen. I'm going to perform hand hygiene, and I'm going to take off the old dressing. And I'll be putting on clean gloves following hand hygiene to remove the old dressing. This is not a sterile procedure at this point. All right, my clean gloves are on, so I will take off any tape and I will remove the ABD pad and throw that in the trash. And I will remove any packing. There's not packing in this wound currently, and I would throw that in the trash as well. At this point, my gloves are dirty, so I will remove my gloves and perform hand hygiene once again. All right, and I'm going to put on another pair of clean gloves because at this point I'm going to be taking a wound culture. All right, so I have my clean gloves on. I will go ahead and grab my wound culturette. I'm going to twist off the top, and I'm going to swab one side firmly, but not too firm to cause any pain to the patient. I'll swab the other side, and then finally I'll swab down the middle. I'll place my swab back in the tube, close it tightly, and then I'm going to mark it with name, date, time that the culture was taken, as well as the site. Go ahead and place that in a specimen bag and send that down to the lab. All right, and then I will remove my gloves and perform hand hygiene once again. And at this point, I will begin to set up my sterile field for my complex sterile dressing change. All right, I'm gonna go ahead and open up my bowl and establish my sterile field. Okay. And I will take my complex sterile dressing tray and dump that onto my sterile field. And I'll leave that for a gauze boat. I'm also going to peel open my surgical sponge / gauze, and I'm going to dump them in my gauze boat. I will set those to the side. And I'm not touching this gauze with my hands, so they remain sterile. All right, and at this point, I'm going to pour my saline into my bowl because this outside of the saline bottle is not sterile, but the saline itself is. And I would have done an initial pour of the saline into the trash, and then I would have poured it into the bowl. And at this point, I can go ahead and put on my sterile gloves. So I'll open my package. Set that to the side, throw it in the trash. I'm going to open up my sterile gloves. Now that my sterile gloves are on, I'm going to set this to the side and I can get ready to do my dressing change. So I'm going to take my gauze from my gauze boat and place it in my saline, get them dampened. Alright, and I'm going to set 2 to the side for packing, and I'm going to roll them up to be prepared to pack in the wound, and I will set another 3 to the side to clean the wound. So I am able to touch the gauze because I am wearing sterile gloves, maintaining sterility. So I'll set 1 to the side for packing, and then another. I'm just going to roll those up. Alright, and then I'm also going to wring out my remaining 3 for cleaning because we don't want them to be too wet as they are cleaning the wound. Also going to set these on my sterile field. Alright, and now I'm going to establish a clean hand and a dirty hand. So I've got my dirty hand here and my clean hand is my right hand. I'll go ahead and take my moist gauze and clean down one side of the wound. Then that would go into the trash. Use that for this purpose. And then I would go ahead and take another moistened gauze and wipe down the other side. Throw that in the trash as well. And then the final piece of gauze I would use to wipe down the middle. Alright. And then at this point, the wound has been cleaned and I would pat it dry with another piece of gauze. And I'm going to take my clean hand and place the packing into the wound. Gently press it down so that it fits into the wound. And then my second piece of gauze on top. Alright, and that wound is now packed. I'm going to take my ABD pad and I will place it over the wound. And at this point, I no longer need sterile gloves. The wound is covered. So I'll remove my sterile gloves. Throw those in the trash. Perform hand hygiene once again. And at this point, I am going to tape up my bandage and I will mark it with my name, the date, and the time that the dressing was changed. And that is all. Thank you.